I'm Dr. Dave Harrison. I'm the inventor of the Wedge Mouthpiece. My background is I've been an amateur trumpet player for 52 years now, so I started playing in high school. I'm also a medical doctor, so my background is music and medicine. I actually invented the Wedge Mouthpiece in 2007 as an act of desperation trying to avoid humiliation playing West Side Story in a community orchestra. I decided I would try to take some of my knowledge about anatomy and physiology and how the embouchure works and things that I'd read about how some players have natural high chops and modify a mouthpiece that would improve my range and endurance so I could actually get through the concert. So it's kind of a mix of medical knowledge with experience as a player. So this is the shape of the Wedge trumpet mouthpiece viewed from the end. If you were looking at the mouthpiece as the mouthpiece is in the horn and the horn's in front of you and you're about to bring the horn up to play. And you can see that the rim is not flat. You can see this curve along here. So there's a high point in the middle, whereas on a conventional mouthpiece, this would be totally flat across here, but it's not, it's curved. And that's the first curve. If you bring the mouthpiece up then into the playing position, you can sort of see the slope of the rims there. The rim is actually oval shaped, and the inner diameter of the rim measured from here to here, the vertical dimension, or the side dimension from there to there. This is smaller. And what that does is it gives us the advantage of more cup volume for a smaller lateral diameter, and that smaller diameter increases efficiency and makes the upper register a little bit easier than a larger mouthpiece because the span of our embouchure is a bit smaller. So not only is there a subtle oval shape to the rim, but that shape actually is extending all the way in the cup right to the base of the mouthpiece until you get to almost to the throat. If you turn the mouthpiece sideways, now you can see there's another curve. So this is the high point at, say, 12 o'clock and 6 o'clock in playing orientation. This is the side of the rim, and you can see that rather than being flat across here, the way a conventional mouthpiece would be, just totally flat, there's a curve there. And that's a curve that actually follows the shape of the teeth. The problem with the conventional rim is that the conventional rim basically locks down our embouchure. The conventional rim gets in the way of the action of these muscles that are all out here, and they have to reach in past the rim and control the central aperture along with all these other factors. So if the muscles that control the central aperture are pinned down by a flat mouthpiece rim, we have a certain amount of resistance we have to overcome in order to be able to control the fine movements and shape of that aperture. Here we are, mouthpiece is in playing position, and then if we turn it sideways, now you can see that lateral dip, that curve, now is oriented so that if your embouchure is here, here's the player, your teeth, usually in most players, will form sort of an arch that follows this shape like that, whereas the sideways curve slopes away from the teeth. So what this does is that when you're playing, it decreases pressure between the mouthpiece rim and the teeth, between the areas of sort of 2 o'clock and 5 o'clock and 7 o'clock and 11 o'clock. The other thing that results from the decreased pressure at the sides of the embouchure is improved circulation. Our central embouchure gets its blood supply from the labial arteries, and those come from the outside to the inside on the face. And this just shows blood supply on one side. This would be doubled on this side. So that's the blood flow in, that's the arterial supply. And then the blood and the leftover fluid, called the lymph, has to drain out. And it drains out again from the inside to outside. And this is a representation of the lymphatic drainage of the embouchure. Again, in order for blood to get in or for blood to get out or lymph to get out, it has to cross across this barrier that's caused by a conventional mouthpiece rim. And because the wedge reduces pressure here and here and here and here, it doesn't block the inflow of blood or the outflow of blood or lymph. And this produces better oxygenation of the central part of our embouchure, and it also decreases swelling or edema because the blood that's in there can now get out without being blocked by the mouthpiece rim holding it inside. So basically, the pressure is transferred here, and the sides of the embouchure are freed to move more. It means that we have more control and easier control of the central part of the aperture, and that's why it improves range, improves endurance, and improves flexibility without compromising sound. So most players will find the wedge is more comfortable, and especially players with braces, because when you add the braces here and here, now you have even more protuberance of the teeth forward. And the wedge mouthpiece arches over those braces, and most players with braces will say that it feels way more comfortable, and they also actually sound better. More importantly than just the discomfort, I deal with lots of players who have embouchure injuries. And the usual injury is their injury to their orbicularis oris muscle, and it almost always happens on the top lip at 2 o'clock or 10 o'clock. And that's the place where there's the maximum pressure between the mouthpiece rim and our teeth, and the muscles are squished in between those two. And that over time produces weakness, and that weakness over time can produce either a partial or complete rupture of the orbicularis oris muscle. So I actually have a lot of customers who've come to me because they've either had an injury or have an impending injury. And because the wedge design decreases pressure at 2 o'clock and 10 o'clock, they feel the wedge is much more comfortable than a conventional rim. And it's been an important part of their rehab because they get on a wedge mouthpiece and all of a sudden, you know what, I'm not having to work as hard. And most importantly, my pain has gone away. So that's the fundamental difference. A conventional mouthpiece pins our lips down to our teeth, and that makes it difficult to manipulate our embouchure. The wedge mouthpiece basically gets out of the way of those muscles and lets those muscle fibers change in length and in tension where they blend with orbicularis oris, and that gives easier fine control. So it's not that normal mouthpieces don't work, it's just that they come along with some baggage, and the wedge was invented to see if we can get around those disadvantages. In addition to the changes in range and endurance and sound, most players will find the wedge is more responsive than a conventional mouthpiece. Most players will say that it speaks more quickly, and they will also say they have better flexibility and at the same time more secure slotting, which is a bit odd because how can a mouthpiece give you better flexibility but for notes to lock in and slot better once you're there? And people will play the mouthpiece and go, you know, what sorcery is this? How can it possibly do that? And my response has always been, I'm not sure, but it just does. But I think what it is, I think it's that the rim shape improves flexibility so you can move from note to note better. And I think people are experiencing a combination of improved slotting from the volume distribution in the cup and a higher cup volume for given cup depth. That's my theory. Most players will find that their recovery time is less, that if they have a really tough gig or practice session, you know, the next day, normally we're kind of beat up. And that's, you know, whether you're playing a brass instrument or whether you're working out at the gym. We all kind of recognize, okay, if we overuse our muscles, the next day we're going to have fatigue, we're going to have stiffness and maybe some discomfort. And that's because of edema and stiffness and cellular enzymatic changes that occur in our muscles with strenuous use. And that's partly influenced by lack of oxygen and micro trauma. And because the wedge improves oxygenation, I think, and reduces micro trauma, less swelling, less stiffness, and therefore a shorter recovery time, so people can tend to get back on the horn without the same stiffness that they otherwise would. Focal dystonia is a condition that affects musicians. The classic presentation for a brass player is involuntary muscle contractions of the embouchure or a tremor. But there are many different variations on focal dystonia. Basically, it's some motor interruption and our inability to do something required to play the instrument. So it's often an involuntary contraction of the lip, which only occurs with trumpet playing. So if you form an embouchure with no intention to play, you don't have any problem. But as soon as you add a mouthpiece to it and go to play, then you may get an involuntary contraction or a tremor. Some players have a problem not with their embouchure, but they have a problem with their tongue. They can't articulate, they can't initiate a note. Some players will actually have no difficulty with their embouchure or their tonguing, but they can't actually initiate a breath attack. So it's some form of corruption of the neural pathway between our brain giving a command to do something and our ability to execute it. Something in that cycle There are many different ways to treat focal dystonia. And in medicine, whenever you encounter a disorder for which there are many remedies, what it tells you is none of them work particularly well. It can be a career-limiting or, in fact, a career-ending problem. I have quite a few players who have tried the wedge with focal dystonia, and they reported back, hey, you know what? My focal dystonia is either gone or much less severe. And I think because the wedge is a slightly different shape, it makes us recruit a slightly different set of muscles and nerves to form an embouchure. For whatever reason, we have to use a slightly different neural pathway. And that seems to somehow get around that corrupted pathway. We make the wedge mouthpieces in-house here now on Gabriel Island, which is in British Columbia, which is where I live. I've always run a CNC mill rather than a lathe, so I have the blanks made for me. And then the blank comes with an exterior shape of a mouthpiece, but no rim and no cup. And then we machine those on the CNC mill, and then they come off the mill. They need to be adjusted, hand polished, the throat adjusted, and then they go out for silver plating. We don't plate here, so they're locally plated also in British Columbia. Then they come back here, and then they go out. Now we make what's called the hybrid mouthpiece. And the hybrid was a mouthpiece that I came up with because I have played on a plastic acrylic top on a brass backbore for a number of years because I like the comfort of plastic, and I like the slightly darker sound of plastic, but I didn't like the way the plastic mouthpiece didn't slot and didn't lock in the notes, and I always felt disconnected from the horn when playing on a plastic mouthpiece. So I decided I would try to make a hybrid mouthpiece that was a combination of a different kind of plastic and a brass mouthpiece that would have the advantages of plastic and not the disadvantages. What surprised me is that long-standing customers who've been playing a brass wedge mouthpiece for years have tried a hybrid, and most of them have converted to a hybrid, and that was never the intention of the hybrid mouthpiece. I never thought it would replace a brass mouthpiece. About probably 75 to 80% of the mouthpieces we sell are a hybrid. So the hybrid consists of a 3D printed insert, which is the rim and the cup, and that insert is then bound or epoxied into a brass base. And the material that we use for 3D printing is actually a resin designed for the dental industry to print permanent crowns. So the material is 65% ceramic particles. So basically it's synthetic tooth material. And the advantages of plastic, it's way more comfortable than a brass mouthpiece. It's less traumatic to the embouchure than a brass mouthpiece. It's very smooth. It always feels warm. And it has a slightly warmer, rounder sound than a brass mouthpiece, while providing essentially the same slotting and actually better response than a brass mouthpiece. I do lots of custom fitting consultations by phone and by Zoom. And at the start of those, players will sort of say, well, what do you want to know? And my response is generally, well, tell me a little bit about yourself and the kind of playing you do and what you want to get out of a new mouthpiece. And that really guides my advice to them, because I ask them, what do you want to get out of a mouthpiece? Because we're all different. Generally, my goals are to find out what the player wants and to provide information that will help them. And then at the end, I'll say, okay, so, having addressed all those things, here's the wedge mouthpiece that would fit those criteria. Here's the wedge mouthpiece that's similar to what you're on now, and here's a wedge mouthpiece that I think is a more appropriate choice for you. And the goal isn't to sell them a mouthpiece. The goal is to inform them about what might work better for them, to make them better enjoy their music and be better at it. So that's the goal, is to provide information. And if I sell a mouthpiece, that's great. I like selling mouthpieces. I'm doing exactly the same thing that I did in 35 years of medical practice. Someone comes in with a problem, and I say, okay, what's your problem? I take a history, and I come up with a diagnosis, and I prescribe something that I think is going to help. So I don't think everybody should play a wedge, but everybody should try one just to see if it's better for them. If it's a better tool, then I think they should use it. There's not really a reason, in my view, not to.